Hello, my name is Vanessa. My specialty population is oncology, and we will be looking at metastatic brain cancer. In introduction to oncology, oncology is a specialty in diagnosing, treating, and supporting patients with cancer. The oncologist social worker specializes in addressing the psychosocial responses, including social, behavior, spiritual, educational. Cancer, of course, is an uncontrollable growth of abnormal cells that does not repair themselves but divide and form malignant tumors in different areas of the body. Metastatic brain cancer, of course, is a metastasis of another cancer, so it's a secondary cancer, also known as end stage cancer. This is usually metastasized from the breast, the lung, the colon, or even the skin. Cancer in itself is the second most common cause of death in the United States. Cancer related death is secondary to heart disease. Um, 80% of cancers are diagnosed in people over 55 years old. Yes, there are some rare or genetic cancers which may affect young children and young adults. However, 80% of all cancers are diagnosed in people over 55. Cancer treatments are recommended according to the location and stage of the cancer, also in response to the patient's age, comorbidities, and cultural or psychological beliefs and or needs. The most common treatment are chemotherapy, radiation, surgery, bone marrow transplant, immunotherapy, hormone therapy, and there is stem cell and precise medication therapy. More women than men will develop metastatic brain cancer. Note that treatment usually concentrate on reducing symptoms related to swelling in the brain or the influences of the overall survival and quality of life of the patient. Some symptoms of metastatic brain cancer may result in severe headaches, poor appetite, nausea, vomiting, vision disturbances, seizures, cognitive changes resulting in behavior or personality changes. The difference in working with this specialty population is to may invade any population and it certainly tests the coping skills of the patient and their caregivers. Cancer is a much feared disease and cancer patients are more likely to have mental illness than the other population. The psychological impact of cancer, especially end stage cancer, or rather metastatic brain cancer, can be devastating and will result in depression, anxiety, and brain cancer is different from other end stage diseases like kidney disease, heart failure, or liver disease because most of those can be treated through transplant. Most of those other populations may have more hope of living longer due to the possibilities of transplant need, and one is financial. The psychosocial needs may include the physical appearance, the uncertainty of how long the person has, and the psychosocial need of the caregiver support. Patients with end stage cancer may or may not have received treatment for previous cancer. May or may not have received treatment for previous cancers. Examples: breast, lung, or colon cancer, either of which would have produced significant changes in their in appearances. Each of these cancers could have been treated with chemotherapy, radiation, or being surgically removed, like the breast being removed or the colon being removed. The patient would have experienced physical changes, including hair loss, skin or mouth sores, or in the event of the breast cancer, of the breast removal would be one treatment. Weight loss or weight increase depending on the person's behaviors post cancer. Uncertainty related to mortality, timeline, end of life planning, or intermittent memory loss can be very stressful for each patient and does present psychosocial stress. Of course, there is the caregiver support. Um, Cancer is life altering and devastating for the patient and their families or caregivers. Caregivers or families will become overwhelmed while learning to support the patient and considering their own genetic connection and their own mortality. Um, the financial needs may result in low nutrition, missed treatments, missed medications, missed appointments due to transportation, or depending on how far they would have to travel, then they cannot afford it. So, financial need, of course, definitely include the lack of insurance, the low income or Medicare and Medicaid ineligibility or eligibility. These do influence the actual treatment process. Social workers working with this group will need to be prepared for challenges, um, which is the challenges of the patient and their families. In preparing, one of the things to do, of course, is education and research practices to understand how to respond to the patient and the family versus the cancer itself. The epidemiology, learning the different location and available resources for treatment, and how does the actual cancer behave, and how and with the influences it does have, which of course one most important is that it's devastating. The person preparing the personality, preparing for surprises, control our own emotions. One of the things we have to do is to understand that when we meet a patient struggling with cancer, they already have challenges. One thing they do not need is to feel judged in any way, and they need a lot of encouragement. They need to be able to trust us. Diversity appears in different ways. Diversity in appearance, experiences, education, and biopsychosocial effects can prepare the social worker to meet and address the psychosocial and financial needs of the patient. Resources for the social worker needs. Engaging in or conducting primary research on cancer care to rationalize outcome when addressing the patient and families. We have to have resources on cost and financial disparities, the availability to find additional research material or where to find psychosocial support for ourselves so that we can continue to be professional, bearing in mind that the social worker must provide facts and maintain transparency at all times. Also help us. Another resource that the social worker needs to know is the eligibility and insurance and differences. Insurances including Medicare and Medicaid. We have to be able to that addressing the need for the patient in the form of the resources, the professional cancer organizations and support network locally and or otherwise accessible is important. There is the American Cancer Society and the Metastatic Brain Tumor Association, which offers education and support services for cancer patients. Resources for the family or caregivers is important because caregiver burnout may result in unavoidable neglect, depression, or poor quality of life for the patient, end of life disease. Therefore, another resource would be advanced directives and associated appointees. Um, End of life planning provides full autonomy over final wishes, introducing the patient to mobile notary public, local healthcare planners, legal aid, or introducing the five wishes and what my family should know documentation are are resources that definitely would make a difference in the patient's planning. Rehabilitation and Rehabilitation and respite care is something else that is also important to identify in the area. Of course, in Pennsylvania, we have local cancer treatment centers that also provides um, palliative care. We have the Abramson Cancer Center, we have Fox Chase, we have the Cancer Treatments of America, and Doylestown Health Cancer Institute. Either of these and a host of others are always important to know. And in knowing them, we also need to know the what are the financial responsibilities of the patient and how this can be resolved and so that they can get the treatment that is needed. In distinguishing social work from others working with clients, we have to think about the person-centered care model, meeting the patient's needs according to their own understanding, acceptance, and goal. Advocating for the patient, um, being mindful of HIPAA, th- being mindful that the patient's rights are not violated, that the patient understands the treatment, that the patient understand that the option to choose and make their own decisions. Planning strategically after gathering information and planning strategically by listening, gathering information by listening, asking open-ended questions, using open-ended interviewing, applying empathy, and making sure that the communication line is always open is the best strategic planning for assisting patients with metastatic or any other cancers. It is important to distinguish consideration. It's important considerations are metastatic brain cancer is an end stage disease that can trigger fear, anger, and self doubt in the patient and caregiver. Each patient conceptualizes pain and illnesses differently, and being diagnosed with cancer may trigger various feelings. Responding to the client's needs by advocating for the best outcome as it relates to the options and goals, therefore applying basic social work skills like attentive listening, observing and reflecting on body language or silences. Being non judgmental will measure the support provided to our clients. Counseling, communication, dispute resolution, because research and continuing education to maintain certification and or stay abreast of current information will help us to preparing and structuring care models for each patient. Here are my resources, and thank you.